Good afternoon, everybody. Today we're going to discuss a very interesting and challenging case that is very close to my heart. This case made me think a lot about how God using us in a very organized and strict plan for everybody to help each other and eventually to reach to the most important goal in our life is to help and serve each other for the sake of Allah. Our patient is a 43-year-old female. She's Syrian, lives in United Arab Emirates. In 2017, she was diagnosed with a rare tumor called uterine sarcoma. She underwent a hysterectomy where they took out her uterus and received chemotherapy as an adjuvant treatment to protect her from recurrence of the tumor. In June 2018, she had recurrence of the tumor in the liver. According to the patient, she had seen all the oncologists in United Arab Emirates at that time, where they have tried with her 4 lines of standard chemotherapy and even new modalities of treatment. And unfortunately, she had failed to respond to any of these chemotherapy regimens. Patient has Canadian citizenship, so she flew to Canada and again have seen surgeons as well as oncologists in Canada, where surgeons told her that nothing can be done for her, and the oncologist tried new investigational treatments on her, and again she failed to respond. For some reason, she ended up meeting one of my patients who I did for her liver surgery back 7 years ago. And she told her, well, try to call Dr. Osama and see if he will be able to help you. So she contacted us by phone and by email, telling us her story and sending us her medical reports. So in order to facilitate things for her, I asked her to send me the images, the actual images, through Google Drive. And this is what I do for most of patients who are from outside Jordan. Before I ask them to come to Jordan, I ask them to upload the images and I review it here. And basically, if there's something can be done, definitely we'll ask them to come. And if there's nothing can be done, we'll tell them to save their effort and money and stay where they are because we can't help them. She sent us the images, and I'm going to show you the images, the MRI of the liver back in September 2019. So the MRI showed a multiple large tumor in the right side of her liver. You see this large mass invading the right hepatic vein. And you can see another very large mass here and multiple other small masses that involving mainly the right lobe of the liver, as you can see. Huge mass in the liver, mainly in the right lobe of the liver, with no response to chemotherapy, as we all know. After reviewing her images, she called me and I told her, listen, giving the history of progression to all lines of chemotherapy and also the way the liver masses looks like, nothing I can do for you. Basically stay in where you're at and continue treatment with your treating physicians where you're at. We just hanged up, and the big surprise, 2 days later, she is calling me from Amman, Jordan, telling me, doctor, I'm here in Amman, I want to see you. Tell her why you came. I can't do anything for you. So she ended up coming to the clinic. And for me, in order to just do my part as a hepatobiliary surgeon and specialize in liver and pancreas, I told her, let's just repeat the images, see if anything changed over the last month. And we ordered for her a new CT scan. So again, the CT scan, as you can see here, show these large masses, and even they are larger compared to the MRI that was in September. And you can see there are multiple large masses in the liver. And the other new thing that I noticed, that there's multiple lesions in her bone, in the pelvic bone as well as in the spine, that according to our radiologist most likely represents metastases. So to summarize, 43-year-old healthy female with metastatic uterine sarcoma that's not responding to any lines of chemotherapy, even new directed therapy or even new investigational therapy as what she had with her in terms of medical reports from Canada. In order to see if I can help her or not, I told her, listen, you need to have a response before anything can be done to the liver. So I called my oncology colleague who is specialized in the GYN malignancies, and I told him the story and asked him to really try to help her if possible. And I told him how impressive her internal belief that we are going to help her. So I sent her his way, and basically what he did is starting her on the very basic chemotherapy regimen. And basically none of these new fancy treatment regimens. He went back to the most basic chemotherapy regimen that could be used in this form of cancer. So he gave her 2 cycles of chemotherapy, and we repeated her images in December 2019. So the big surprise was there is a response. So patient, the first time over almost a year and a half, she's having a response from a basic chemotherapy regimen. You can see these multiple liver masses had decreased in size significantly. You can see there is now necrosis in this tumor mass right here, and there is significant reduction in the size of the big mass that was down here in the liver. With this CT scan results, we were all happy for the patients. She was very happy, her family was very happy, as well as the oncologist and myself. So he gave her 4 more cycles of the same basic chemotherapy regimen. We ordered for her a PET scan in February 2020. The PET scan showed significant reduction in the size of the tumor masses with no FDG activity. None of the liver masses were FDG active, and none of the bone lesions were also FDG active. There was always a complete response based on the PET scan. We decided at this time that the next step is to do surgery for her to take that part of the liver out. And we always remember what happened in February 2020. The COVID pandemic had spread all over the world. All the airports were closed. We tried to help her to come to Amman through special permissions, and at that time the airports in the UAE and in Jordan were closed. So I ended up asking one of my dear colleagues, liver surgeons in Cleveland Clinic, Abu Dhabi, to have a look at the case and to tell me what he thinks. So when she saw them in Abu Dhabi, they did not believe the whole story and did not believe the excellent response that this patient had with this basic chemotherapy regimen. And they were really reluctant to proceed for surgery, and even though they ended up doing a new PET scan for her, despite the fact that she had PET scan only 2 months ago. Let's see what the PET scan in April 2020 had shown to this patient. The PET scan again had showed complete response. There is no FDG activity in the liver, and none of the bone lesions also had light up on the PET scan, indicating again a very excellent response to this basic chemotherapy regimen. In this regard, and basically for us as a surgical oncologist who deal with cancer, we know there is no way to tell for sure that she had a complete response unless we take this part of the liver out. So after several discussions between me and my friends, I convinced them to proceed with liver resection. So in May 2020, she underwent a right hepatectomy. They removed the right half of her liver and they sent it for the pathologist. As you can see here in the images, this is the tumor, the white thing in the specimen right there. And you can see this is the remaining part of the liver, and this is the inferior vena cava in the lower part of the image. The big surprise for everybody that the pathology had showed complete response with no residual tumors in the specimen that is resected, indicating her excellent response to chemotherapy. Patient had recovered well from surgery and she went back practicing her life without any treatment and without any further pain and tumor in her body. She had the last contact with us was in September 2020, where a new PET scan was done that showed again no evidence of tumor in her body. So we go back in the story that we had here. It's amazing how this patient decided to come to Jordan and how she internally believed that we are going to help her, despite all the scientific fact at that time that nothing can be done for her, given the history that she gave to us. So again, we always ask Allah to guide us and use us in the help of these patients. For me, I did not do anything for this patient other than I referred her to my oncology colleagues. I didn't do her surgery, I didn't do anything, but I was the key for the success of the cure and the cure for this patient, which is something I always ask Allah to use me to help people. Thank you very much for following us. If you wanted to hear more stories and more interesting stories about challenging cases with very happy endings, please don't forget to follow our YouTube, Instagram, Facebook, as well as Snapchat. Thank you very much.